Hi, my name is Mana Moroya. I'm presenting my change idea, improving patient flow in an outpatient radiology practice as applied to Lippitt's change theory. As we know, healthcare is in a constant state of change. Patients are savvy customers and more involved in their healthcare than ever before. They not only expect positive outcomes, they demand convenient and efficient services. With changes in how healthcare is funded and reimbursement policies set by Medicare and Medicaid, it is important that healthcare professionals consider patient satisfaction scores, as these are used to determine reimbursement rates. The Institute of Medicine and the Institute for Healthcare Improvement believe that patient safety, positive patient outcomes, maximizing patient satisfaction, and enhancing procedural quality and efficiency are integral to medical care. The Institute for Healthcare Improvement specifies experience of care as one arm of its triple aim framework for improving healthcare. As nurses, we should not only be concerned with better reimbursement rates, but work to improve the quality of care and quality of life for our patients. Increase patient safety, improve patient outcomes, maximize patient satisfaction, and enhance procedural quality and efficiency. There is a plethora of information in the literature on the topic of patient satisfaction. Here I included 3 studies that demonstrated an inverse relationship between patient satisfaction and wait times in the ambulatory setting. The 4th article is an interview with top radiologists in the country who agree that patient comfort and efficiency of throughput, which is the patient flow from arrival to discharge, is important in meeting the demands of the customer. Here is a study done in the primary care clinic. Here is one in an outpatient orthopedic clinic. This is one in a gynecology clinic. And this is a summary of an interview with those radiologists. Lippitt's change theory describes planned change as having 7 phases. It is an expansion of Lewin's theory of change, focused more on what the change agent must do than on the evolution of the change itself. It is very similar to the stages of the nursing process, ADPI: assessment, diagnosis, planning, implementation, and evaluation. Phase 1, diagnose problem. Form a team, choose a leader, develop a plan and evaluation tools, gather and analyze data, and set a timeline. In my case scenario, the team would be made up of representatives from the groups that work in the area. We have clinical assistants, LPNs, RNs, and CT technologists. A radiologist and the nurse manager should also be included. A leader would be chosen. In this case, it will likely be the RN, since this is a nurse-initiated project. The team together would develop a plan to address the problem. The basic issues that were identified are poor communication and complicated workflow that lead to patient satisfaction and poor employee morale. The team would gather and analyze data and set a timeline. The evaluation tools that would be developed would be a survey, a patient survey, and an employee survey that can be administered before the implementation and after the implementation. The other data that could be collected would be the wait times of patients from their visits, which are tracked in the computer. We can then determine whether the change implementation made a difference in patient wait times and patient satisfaction scores. We could also use the HCAHPS, the Hospital Consumer Assessment of Healthcare providers, and systems scores that are done in the hospital. Phase 2 would be to assess motivation and capacity for change. Everyone who will be involved in the change should be informed. The team would respond to concerns and address resistance. Resistance is to be expected because people do not like change. Phase 3 is to assess change agents' motivations and resources. As I mentioned before, the RN will probably be the change agent. Nurses are good leaders. They empower others. They empower their colleagues. They empower patients. They can influence change and improve efficiency and quality of care. Nurse as change agent is a good idea. Phase 4, select progressive change objectives. As I mentioned earlier, the main issue identified was poor communication and complicated workflow. We have different groups of personnel working in the area: clinical assistants, LPNs, RNs, and CT techs. Everyone has different job description, everyone has a different role and a different responsibility. In addition, there are a variety of exams with different exam lengths. There's need for specific scanner technology for certain exams, such as cardiac exams. There are varying drink times for different exams. There are different changing requirements. Some require a gown, others can leave their street clothes on. Then there are nurse assessments, port access, IV starts. Sometimes these can be very difficult. And then we have interpreter needs. Some patients are waiting for long periods of time in different areas, which delays their care. Timing is critical for a smooth transition from start to finish. So the proposed plan is to implement a Skype for Business chat room in this area. This technology tool is already being used in different areas of the department and the organization. This chat room will allow all the employees, the clinical assistants, LPNs, RNs, and CT techs to collaborate and communicate with fewer interruptions. The goal is improved patient flow, getting patients ready for their scan time by their scheduled appointment. Education will be critical in explaining how, when, and for what reasons to use Skype. For example, if a CT tech would like the nurse to start an assessment earlier, she can send a Skype message. A nurse must respond that they noted the message. Everyone sees the messages. Patient is brought back to be assessed. Another example would be a CT tech letting the LPN know to start drinks on a patient. LPN responds. Everyone sees the message. Message noted. Everyone knows what's going on. And finally, setting a time for implementing the change and maintaining the change. Making sure we have dates, beginning and end. Phase 5 is to choose the appropriate role of the change agent. The change agent will manage the change, implement it and manage it, support the staff, address resistance, address challenges, barriers. Maybe some tweaking needs to be done. This is the time to do that. Phase 6 is maintaining the change. Constant communication, feedback, teamwork, evaluation. Are we improving patient flow? Are patients more satisfied? Is employee morale up? Maybe we need to think about something that needs to be tweaked in this area. Constant evaluation, constant communication back and forth. This is what is happening as we're trying to maintain this new change in the area. And then phase 7 is terminating the helping relationship. Basically, we're making the change permanent. We're moving the change agent from the role. That person can be available from time to time in the future, but they are not formally in the role anymore. The change has been made part of the status quo. And in conclusion, change should be planned and implemented gradually. Using a framework will increase the likelihood for success. Change agents must have good leadership skills. And here are some references that I used in my project. Thank you.